So what is the best way to stop from being a pre-diabetic and turning into a full-blown diabetic with all the problems? Is it better to start medication now, or does lifestyle changes in diet and exercise prevent you from becoming a diabetic? We need to know. I'm Dr. Peter Montgomery. I'm a family practice doctor, board certified with 30 years of experience, and I'm here to share with you my advice. There is a journal that I get every month, and it's called the American Family Physician, and they have a journal that has detailed articles that I like to share with you. I got to read them anyway for my education, so I thought I'd make some videos and share my experience with anybody who wants to hear what I have to say. So before I go on, I'd like to talk about my sponsor, or actually who I am sponsoring. It is a free medical clinic near you. I'm here to show you about the National Association of Free and Charitable Clinics. It's a national organization. It is fantastic. The National Association is associated with 1,400 free and charitable clinics. They serve over 1.7 million patients annually, and there's over 175,000 volunteers, of which we always need more. You can find a clinic near you by going to this website. They'll give you information. You can contact the clinic in there, and you can donate to the organization or to an individual clinic. This is fantastic. You can go on their search engine, find a clinic near you. Here's the clinics all around Dallas, within 200 miles of Dallas, Texas. All the clinics around Chicago. All the clinics around Los Angeles. All the clinics around New York City into Connecticut to New Jersey, and I am located in Missouri. These are all the clinics in Missouri. This is the free clinic that I work at, called Crossroads Clinic. We're a volunteers in medicine clinic. We're open 2 days a week. Here's our phone number right up here to call and make an appointment. Here's our donate button if you want to help us out and donate. We really appreciate it. If you can donate yourself and volunteer, that would be fantastic. We always need more doctors and nurses. We need clerical staff, people who can help run the clinic. It is fantastic. We need everybody's help. And I really appreciate everybody who can help out in here. Little show of our website here and our visits. We've had over 728 patients visits last year. We get new patients every year. Here's me with Dr. Hicks and Dr. Ron Weprick, a couple of the volunteer doctors. There's our board of directors here. I'm bringing that website up. There's me. Here's Cheryl Molenhoff. She's a nurse who really runs the show, and the rest of our executive committee. And Dr. Begg, it was her idea. She's the founding member. She goes, we got to help out and do this. So and it takes all these people, and this is just the board, and there's several other dozen more volunteers who actually make everything work. So please check out the free and charitable clinic near you. Go to their main website, find it, and help yourself. If you don't need help, you might have a family member or a neighbor who needs help. And if you can volunteer, fantastic. If you can't volunteer, please donate to a free clinic near you. Now, back to our topic about how to prevent the advancing of diabetes. All right, here's an article from the Journal of American Family Practice, and it said, metformin or lifestyle changes to prevent type 2 diabetes. The short answer, metformin is more effective than lifestyle at preventing progression to type 2 diabetes. There's a few caveats there that I'll like to go into the details. But metformin, it basically, the name says it reformulates your metabolism. That's why they came up with the name metformin. It definitely helps with the metabolism. But exercise does work. It was a very close, I'd say, neck and neck evidence here for you. So the details, they did a study in 2019. They looked at 20 different research clinical trials. Just to be clear, this is my first video. I want to make sure that you understand what a research clinical trial is. It means that's as good as we get with science. There is They do what they can to get a large group of people. They follow all the strict criteria for eliminating bias. Often the patient doesn't know what they're getting. It's called blinded. The doctor doesn't know what he's giving. That way he's blinded. That way he's giving equal evidence to both things. They try to balance out the groups. Now, it's hard to have a placebo for exercise. So they have to make adjustments for different things. But they looked at 20 different trials over the years. And they followed up for at least 1 and sometimes 3 years of the treatment to see did it prevent the people from developing diabetes. And they did a very good job. And they found out that metformin was just slightly more effective than exercise. There was almost 3,000 people in the study, so that means it was a pretty good study. And the breakdown of the evidence was that the sicker the person was, or the closer they were to true diabetes, the better the therapy was, the better the diabetes medication worked, metformin is, and the better the exercise worked. Now, when you get into the evidence a little bit more, you can see what happened here. The largest trial, they had over 3,000 people in this one trial. Everybody had a risk factor for diabetes but did not yet have diabetes. They had high sugar, they had a high BMI, and they compared the medicine to exercise. Now, the exercise was 150 minutes of exercise a week. They either had to come in and work out in their gym, or they phone called and made sure that they were being compliant. So they verified people really getting the exercise. 150 minutes, that is 5 times a week for 30 minutes. That's a lot of exercise. And the goal was to get them to drop their weight significantly, or they're going to take 850 milligrams of metformin or a placebo twice a day. You got to have your placebo group for it to be a good research clinical trial. In the metformin group, a 31% reduction in the people developing diabetes. Fantastic. With the intensive exercise, even better results, 58%. I know earlier I said the medicine was better. That's because this is where they verified the person did the exercise, and they did a lot of exercise. Your average person does not change when Dr. Know-It-All says, please change your behavior. They've done studies on that. About 5 or 10% of people will make long-term changes for up to a year with intense, follow-up. With someone just mentioning it once a year, it's less than 5%. Taking a pill, well, only 2/3 of people actually ever fill their prescriptions. And 2/3 of those people who fill it will take it correctly on a regular basis. That adds up to about 50% of people will actually fill a prescription and take it on a regular basis. Well, 50% is 10 times better than 5%. So that's why the metformin wins out. I don't think it's the better option. I think the better option is the exercise. But if you're able to do it, the problem is not everybody has good knees. Some people have shortness of breath and lung conditions and other things, or they just don't have the time to exercise. So people who can't exercise is just too much of a change for them. Metformin will work. Metformin has side effects. It's a medication. The most common is loose stools or diabetes. It happens in about 10% of the people who take it, and it improves if they eat less sugar, less soda pop and less sugary foods. They have less diarrhea, which of course helps you avoid the diabetes, help you control your diabetes if you have it. So eliminating sugary drinks, and that includes alcohol. Then it reduces the number one side effect of metformin, which is the loose stools and the diarrhea, which can be pretty severe for some people. Sadly, within this all these studies, the exercise does have to be fairly intense and very frequent for it to work. In a lot of these studies, they did follow them up for a long time afterwards, and some of them up to 15 years of follow-up, showing that if they kept up with the prevention attempt, that 88% were able to stay not diabetic. So this does work. Lifestyle intervention is great and fantastic if you can really stick to it and if you're healthy enough and have the healthy joints and the time to exercise. If you don't feel bad. Metformin is effective and should help you keep from becoming diabetic if you stick with it. So thank you very much for watching my first video here. And so thank you again for watching this video with me. I hope you learned something about it. Diabetes can be prevented if you're pre-diabetic. Medication does help. Lifestyle changes, dieting and exercise help, and you got to really stick with it. You know, pretty much what we understand about diabetes, most of the time it is our lack of exercise and eating healthy that pushed us over the edge into that. So it is definitely something that can be reversed, and that's good news. So hopefully you'll look forward to the next video I'm doing. I'm going to cover topics as often as I can when I have the time to do it, and remind you to, if you don't have health care, to help find a free or charitable clinic near you. And if you can, volunteer your services, help out. And if you can't do that, then please donate and help us stay in business so we can help people. Thank you very much. Dr. Peter Montgomery. Thanks.